Good morning. I'm going to do a postural drainage. So the first thing that I'm going to do is check the patient's chart, and I'm going to look to see if they had a chest x-ray done to see where the where it's located, where the drainage is at, and everything and where anything is blocking in the lungs. And so the first thing, then I would knock on the patient's door, introduce myself, check the patient ID band, make sure I have the appropriate PPE on, such as a face shield, gloves, anything like that. Always wash my hands before I help the patient. And so when I'm ready, I'm always going to check the patient's vital signs, and then I'm going to listen to the lungs to also confirm to see where I hear any of the abnormalities for the patient. So here's a position that I'm going to be having the patient in. So I'm going to, assuming this is the back of the bed where their feet would be. So I'd have the patient feet elevated up, and then I'm going to have them kind of facing more downward hill, kind of like that, like this. And so the head's going to be down. I'm going to have their arms facing forward that way. And then I would have a pillow underneath their stomach. And then I'm also going to have a pillow underneath their feet there, so that way I can get the appropriate percussion and drainage for the patient. So always, before you do any postural drainage, always look at the contradictions for the patient. If they've had any surgery, any broken ribs, anything that can cause complication, if they've had postural drainage before, if they've had any complications with it, always note that. So when we are ready, and then you would either get a mechanical machine to do the percussion, or then you would have a percussion cup. But if you don't have that, you're going to have to use your hands. So then you would take your hand and do kind of like a C shape. You're going to make a cup, so that way when you go, then you can get a nice firm percussion on it. So you always want to not hit anything up here like the bone. You don't want to hit any bone like there. You only want to hit like in the middle here where the ribs are. Don't want to hit lower than that. Don't want to hit in the spine, so you don't cause any injury to the patient. And if the patient's had a meal, you always want to wait until like 1 to 1.5 hours, or you can do the percussion before they have a meal. So when you're ready and the patient's all set up, everything's good to go, then you get ready and then you do the percussion like this. And always, when you're doing percussion, like the postural drainage with any patient, you always need to face them at all times, especially when they're on their stomachs or anything like that, because they can aspirate if they end up vomiting, or if they cough up something while they're in the position. You want to make sure they don't aspirate anything back down to cause any more complications for the patient. So when you are finished, you will reposition the patient, make sure the patient is back and comfortable. So you would remove the pillows, and then you would place the patient back around. You can have assistance, but always when you have the patient here, when they're sitting in that bed, like, you want to have them sitting up, and then you're going to have them cough and make sure they have any loose secretions. You want to cough those out. And so then you're going to have a basin, or if they need a sample, you need to make sure you have a sample cup for the lab, for that to be sent to the lab, and with the proper labeling on that. So when you're finished, make sure they're comfortable, reposition them, and then you will check the vital signs, listen to the lung sounds again to see if it's improved, and then you would remove any PPE, wash the hands, chart any of the sputum samples, what it looks like, the coloration, like if it has a distinct odor, and then chart it on the patient's chart and let the staff know.